Hey guys, welcome to our channel, the Radiology Counselors. And okay, on much public demand, we are here with the most anticipated review of the year, Kokilaben Ambani Hospital Radiology Residency DNB review. And with we have two of the ex-residents with us, Dr. Ayush and Dr. Ruchi. And I am your host, Dr. Sachin Kumar. I did my MD from Jipmar Pondicherry way back from 2016 to 2019, and then I was a senior resident in Kokilaben Ambani Hospital from 2019 to 2020. I have worked with Dr. Ayush and Dr. Ruchi for a very brief period of time while I was about to leave the hospital. And so, yeah, Ayush and Ruchi, please introduce yourselves to our viewers.
Hello everyone, I am Dr. Ayush Srivastava and I was a resident in Kokilaben Hospital from 2020 to 2023. I am currently working at RML Hospital Delhi as a senior resident.
Hi guys, I'm Dr. Ruchi and I was Dr. Ayush's batchmate. I also did my residency from Kokilaben Hospital from 2020 to 2023 and currently I'm working as a senior resident in radiology at KEM Hospital, Mumbai.
All right, guys. So let's just go straight to the questions. What is the structure of department like in terms of number of residents, the consultants, Dr. Ruchi?
So basically, the department is structured in such a way that there are six primary residents, two per batch, and there are four secondary residents, the ones who have already completed their DMRD, and there are two senior residents. So in all, the capacity of the department is around 12 people at its full strength. We have multiple consultants and we have dedicated consultants for specific image systems. So, like in CT and MRI, we have three consultants who are dedicated to neuro imaging and musculoskeletal imaging, and we have two consultants who do cardiovascular and body imaging. So, in ultrasound, also, we have subspecialized sonologists. Like there is a ma'am who just does musculoskeletal ultrasound. Then there's another ma'am who does mammosonography. There's a ma'am who does pediatric radiology. So everybody does subspecialized work. So they're extremely good at their work because they do kind of similar things each day. And we also have Dr. Ravi Ramakantan. Everybody knows him. So he's been the HOD of KM Radiology for 40 years. And he was also our HOD. And currently, he's the academic head of the department. So he's responsible for a lot of academic activities that happen in the department right now.
Yeah, he makes sure actually that the residents have a lot of activities. I've seen him, like that man is a
Mhm.
powerhouse. So, Dr. Ayush, next question is for you. How's the posting routine like, and how's the schedule of the residents there? Is it too hectic, too light? How's everything?
So the posting timings are like 9 to 6 or 7 in X-ray and ultrasound. Then it goes from 8 to 8 in CT and 8 to 9 in MRI. So in the beginning, the timings can be quite extensive and quite long, and it goes for up to 1.5 years. But then after that, once we get to learn the basic stuff, we get to divide our postings in certain shifts of around 8 to 12, 8 to 10 hours, and there are a total of around 10 residents at a time, and the night duties are divided equally among all the residents as well as all secondary DNBs and SRs. So on an average we get around one night duty per week and one Sunday per month. And I would say the uh, duty timings and night calls also are quite heavy, and it's not very chill. In night duties also you get many cases and you have to report all the cases in the night itself. So
Yes.
Yeah, if a stroke comes at night, when I was there, if a stroke comes, then yeah, your night is gone. If two strokes
yeah.
come, then yeah, you're over. But yeah, but in night duties, I would like to add that night duties are a great time to learn and take responsibility in a very graded manner. You're always there with your seniors. Primary residents are always there with either secondary DNBs or clinical associates. I was a clinical associate there, so yeah, it's you take responsibility in a very graded manner. Like with third years, it was a lot of responsibility. Second years, a little less, like that. Dr. Ruchi, how's the leave situation like? Do you guys used to get leaves easily? How was it?
So, according to DNB, basically we are granted 30 leaves in a year, and the consultants are really very friendly and approachable. So they will not say no to you for a leave. The only thing is that you can't take very long leaves because there are lesser number of people in the department, and whenever you're taking a leave, you have to make sure you adjust it with whoever's posted with you and with the other batchmates of yours. That's the only issue, but otherwise nobody is ever going to say no.
All right, all right. And how's the exposure, subspecialty wise and modality wise, guys?
So the exposure I would say is really good, especially in cross section, both CT and MRI. We get to see a lot of cases, a lot of variety, as well as very good cases. Many of the things that we only read in textbooks we see there. And in ultrasound, I would say there's good freehand in abdomen and pelvis, but in many other things, I would say we are lacking, like especially in obstetrics, which is close to zero, and also there's no sonomammography and small parts ultrasound like thyroid, MSK is also almost non-existent. So that part can be made better. And also in X-ray, I would say we don't get as much exposure because we are not posted much in X-ray itself. And but in cross section, the exposure is very very good.
But yeah,
Uh,
I would like to add that X-ray exposure is close to zero almost everywhere. I did my MD in Jaipur. Even there was no X-ray postings. Like nobody gives attention to X-ray these days. That's the sad part.
But I just would like to add one thing that a new thing has recently been started that they are trying to incorporate mammography along with the X-ray posting. So
No,
whoever's posted in X-ray, they also have to go to mammography for a few hours and actually do mammography. Yeah, so that will be a good addition. And another thing that has been started recently by our new DNB coordinator, Dr. Vinita, is that she's made sure that all the residents who are posted in ultrasound, they are also rotated in the sono mammo room for 1 week. So 1 week in sono mammo, 1 week in Doppler, and 2 weeks in general ultrasound with the other two consultants. So that's a good thing I feel, which is a new change in comparison to what we had experienced.
all right, okay. And how's the department technology wise? How's the PACS situation there? Because PACS is really essential.
So PAX is just amazing. So you just type a word, you type your name, and you'll be able to access a report that you typed like 3 years ago. And it's a very good thing. It's a
I
blessing.
was there when I was there. I think it came like
Yeah, so it's a new thing. It's a new thing as in it had happened during our residency also, which is extremely good. I'm able to access a case which was done like 7, 8 years ago in the department. So PACS is an absolute blessing because even big government hospitals and a lot of hospitals don't have PACS in
yeah,
India.
they don't because
Yeah.
so Jipmer had a very good pack system, and when I came to Kokilaben, I never missed Jipmer in terms of packs because Kokilaben pack system is at par, it's state of art. And after that, I went to Ames Patna. Ames Patna ka packs was dismal; it wasn't good. I haven't seen a packs like Kokilaben's anywhere else. And now that Dr. Ruchi is saying that you can actually search retrospectively in terms of diseases, that is actually a very good thing, guys, because you
Yeah.
can learn retrospectively, you can correlate, you can actually do retrospective research. Like if you want to write a paper on say X disease, and then you just write that okay, I want this disease, and then it will fetch you all the reports. That's actually great for research work, and you can publish a lot of things there. So
Yeah,
that's
and
actually,
Yeah.
and that's something that is lacking almost everywhere, I would say. Like
yeah,
most of
every
the
Yeah.
it
hospitals
wasn't there
do
even in
not have a
Jipmer.
PACS.
Keyword
Yeah,
searching is
yeah.
amazing. That's great. And how are the machines? How are the machines there?
Just
Machines.
state of the art machines. Yeah. Sorry, you can
I
take it.
think yeah, the CT scanner that time only was Force 512 slice. HRCT used to take what 2 seconds, and three Tesla MRIs are there, and those are two in number. I work in Medanta, Patna. There's only 1.5 Tesla single MRI. So yeah, Kokilaben is really advanced actually, and it the MRI has got all the coils. Like they have even
Yeah.
their coils. The
Yeah.
resolution there is amazing in those coils.
And even the technicians are really well trained. That they will give you the best quality image that is possible,
Yeah.
which is free from artifacts. So that's also one very good thing, because in a lot of places I've just seen that they do it just for the heck of it to finish patients.
Yeah, but that can also hit back later because once you get used to the
Yeah,
imaging,
it's
there's
going to
no
be
coming
difficult to
back.
Yeah.
report.
Every image will
And
irritate.
I would like to add that we also had flash mode in CT, which can acquire scans very quickly. And then we used to do all advanced kind of studies in MR, like we used to do MR spectroscopy, tractography, all kind of studies we used to do. So that was a very good thing.
Okay.
And I'd also heard that they were gonna get a photon counting CT. So if that happens, that would be amazing.
Wow. Okay, and do you guys have like dictation software? Like, do you guys dictate your reports or do you guys type it like the old days?
Yeah, that is something that I miss the most. That we just used to dictate and type our
Absolutely.
reports, and I was so used to it. Now we have to write it.
Yeah, yeah.
Yeah.
In hospitals, you have to type out your reports.
Now
Yeah.
you have to manually type your reports and correct your typos. So that
Yeah.
seems like a big thing to do now.
Okay, one more thing. So intervention radiology. A lot of people get into radiology thinking that they are going to become interventional radiologists. How's the exposure there in terms of interventional radiology?
So basically, all kind of procedures happen here, and it's a really good intervention center. Especially, it's a stroke intervention center. So there are like flow diverters,
Mm.
aneurysm coilings, and mechanical thrombectomies, which are happening like on a daily
But
basis,
how much
which
of
will
this
not.
exposure do the junior residents are getting? Like, are
It
they
dep-
getting that from?
it actually depends on how interested you are, because a lot of people step into radiology thinking that they want to do intervention, and once they get into, they're too comfortable with diagnostics.
I was one of them.
Yeah, even I've been one of them.
Yeah.
So
Yeah,
yeah, it all depends on how interested you are.
yeah, yeah,
If
true.
you're interested, then they will let you do. They're not going to say no. See, one thing is that they never say no to anything.
Yeah, that is there. That is there. Dr. Ayush, how's the academics? How's the teaching programs, seminars, and everything?
The academics are very good. We used to have regular seminars, and weekly we used to have X-ray classes by Ravi sir, Dr. Ravi Ramakantan. And even the consultants are also very eager to teach. They love to teach, and they would love to discuss any case whenever you want. And yeah, the academics overall were very good.
Mm.
And
One more thing that I noticed there is that if you make a mistake in a report, they won't scold you like badly.
Hmm.
They call you gently. They'll tell that, hey, actually you missed that. I think, and you'll feel really bad that this guy
yeah,
is like not scolding me. He's like so gentle.
If you make a good report, the consultant will actually take efforts to give you good positive feedback. I think that's extremely rare.
yeah,
Like nobody would
Yeah,
appreciate your
so
work.
the thing is that that department is not toxic. That's like
Yeah.
anything but toxic. That is true.
I've had like consultants calling me even after work hours that, you have reported this case really well. So, like, it was a good report. So,
And
that's very rare.
and I'm in touch. Like I left Kokilaben in 2020. I am still in touch with those consultants. Today itself, I got a doubt in HRCT. I'm a consultant at Medanta. I got a doubt in HRCT, and I was like, who should I ask? I FaceTimed Abhijit sir. Abhijit sir was a consultant in KDS that time. For the viewers, Abhijit sir was an amazing faculty. Right now, he's in HN Reliance. That time, he was in KDH. And I called him, and he's like, always takes my call. I'm like, हाँ अरे ये तो ये है ये तो ये है अरे इसको ये दे दे. Like the consultants there are amazing, and they are
yeah.
always eager to help. So okay, guys. So let's discuss how's the money situation like. Stipend. Is it enough? Is it less?
So, the stipend is 88,000, I think. When we were residents, it was much less. So,
Mm.
that's an additional plus. So the stipend I think is 88,000 and you get approximately 84,000 or something in hand, which is like because you're also getting the hostel. Just end up paying for like your additional expenses like food. So I think it's pretty good.
Okay, so 88,000
So
is.
yeah, so the stipend is at par with the state stipend. So if the state government increases the stipend, the DNB stipend increases.
I
If
think
it
88
increases any further in the upcoming
is,
years, yeah,
yeah, enough for a single person. And also, I would like to add that
yeah,
you don't have to pay for your accommodation. Kokilaben actually pays for your accommodation. It is
yeah.
in Andheri West, which brings us to another section. How's the accommodation like?
So, so yeah, the accommodation is good. I would say it's a pretty good hostel, but there are many drawbacks to it. First of all, the location. The location is very
The,
bad,
the
even though it's in
location is
Andheri.
actually very shitty, guys.
Yeah,
It's not.
yeah. Even though
Okay,
it's
so
in Andheri, the location is pretty
So,
bad.
so the location is in Andheri West. Andheri West is a like the happier Andheri. It's not Andheri East, but it's on a very sadder part of Andheri West. So when for the first time, if you go to that location, you're like, what is this location? Why I am even here? But the hostel itself is good.
Yeah,
Hostel is good. The rooms are good. Everything is fine, and it, I, the location is not unsafe. Don't think that it's unsafe. It's just that it's kind of slummy, maybe. Yeah. Yeah, it's in the crossroads, but the
yeah,
hostel is good. One more irritating part about the accommodation is that the security there at
yeah.
hostel are paranoid. They won't let your parents, they won't let your friends, they won't let anyone come upstairs, and they won't even let Swiggy, Zomato. Sometimes you have to like go downstairs to even get all your parcels, everything, and they are like very paranoid. Ruchi had an experience. Please tell Ruchi.
Yeah, not living in the hostel, even I was not allowed to go to the hostel because I didn't have a room. Despite being a resident there and working
Yeah,
like my ass off
she
for the
would
hospital,
escort on our parties. We would have to like
I
sneak.
would sneak in.
Yeah, but okay. The hostel is in a bad part of Andheri West. That is there, but it's Andheri West. It's one of the happening parts of Bombay. You can enjoy all the parts of Mumbai are very accessible from there.
Yeah.
So yeah, overall it's good. So I think what else? What else? I think we have covered everything. What else? I think rest of the questions, guys, you can ask in the comment section. We
Yeah.
will totally read those comments and try to answer all of the
So
questions.
one very popular question which I've been getting from people is like, should I take MD or DNB radiology? So
Yeah.
does anybody have any insights? Like any one of you guys
Yeah,
would like to?
I like to give some insight. Okay, so doing MD from a peripheral bad college and doing DNB from a good corporate hospital. Always choose DNB from a good corporate hospital like Kokilaben. Never waste your 3 years of your precious life, and those are your like foundational 3 years. Don't waste doing MD at some trash government college where people are not interested in teaching you, where you don't have equipment, where your reports are not getting cross checked. Why do you want to just waste your 3 years just to get that MD tag? It's not gonna matter later in life. I passed my MD in 2019. I am experienced enough to tell you that please take DNB at Kokilaben, or for that matter, any good college. Take DNB at Hinduja over doing MD at some God knows where college where academics are nothing.
And other important question, which even I had when I was about to join DNB radiology, is like I always thought that whether people are going to distinguish me because I'm DNB, or are people going to consider me inferior because I have not done MD. So is that the case, or is that kind of an experience? Uh, have you guys come across that kind of an experience?
I think only the insecure MDs from actually who are not from a bad college think they are superior. The people who have done MD from good colleges who are actually knowledgeable will never have that feeling. They'll never make a DNB person make it feel inferior.
Yeah, in fact, I would say now that the trend is changing, more and more people are taking up DNB. In fact, they feel that a person who has cleared DNB is much more well read than, you know,
Yeah.
most of
Yeah,
the,
it doesn't
random
matter.
MD colleges. Yeah.
So yeah, so this is it. I think closing remarks, guys. Any one of you?
If at all you're in
Um,
doubt about taking up Kokilaben, I would say you can just go for it. You are not going to regret it. And yeah,
Yeah,
yeah.
even I was in Kokilaben for a very brief stint. I was there for 1 year, and I was actually coming from a very good college. I was coming from a central institute and landed in Kokilaben, and I never regret coming to Kokilaben. Those were like one of my best 1 year of my life. I learned a lot of things. So in Jipmar, actually, I learned a lot, but in Kokilaben, actually refined my language, refined my entire spectrum. It actually increased my. It actually made me learn how to take responsibility and how to report like more independently. And after
Yeah.
that, I went to AIMS Patna for another 2 years of senior residency. But I still think that in Kokilaben was really great. It was really amazing in terms of learning experience. So yeah, take it.
Yeah, it's worth it spending 3 years of life in this place and building an amazing foundation, which is going to stay with you for the rest of your life.
Yeah. Any negatives like you guys? I think the only negative is obstetrics.
Yeah,
If you want to
obstetric
learn
ultrasound.
obstetrics, yeah.
also
If
I
you are
would
like,
like to add about a negative that the workload depends on the number of residents. So if the total number
uh,
of residents are less, there is
Hmm.
definitely going to be a lot of work, and it
yeah,
can get pretty hectic, especially in Kokilaben.
Hmm.
So that is something you should keep in mind. It's not easy
especially
to,
when the final year has exam,
yeah. So it can
it
be
can become.
a bit tough, yeah.
I have been there in CT with junior residents till 12 a.m. So guys, that can happen, but I think sometimes it should happen.
Yeah.
Sometimes you have to overwork. It's a part of life experience. It never gets very toxic. People are
This
very careful.
the spectrum of cases that we get here and the clinical approach to radiology that we learn, I think will make up for the
Yeah.
workload. And I
Yeah, yeah,
feel like when I used to work the most, I learned the most.
Yeah. And you
yeah.
get to
True,
So
learn a
true.
lot.
In especially during 3 years of residency, one should never be afraid of
Yeah.
overworking.
yeah.
You should overwork. I mean, why not make the most of it? Okay, guys. So I think that's the end of the video. I think it's already very long. I hope you guys found it helpful. And yeah, write to us in comment section. Bye bye.
Bye
Bye
bye.
bye.